Good evening, everyone, and welcome to our program tonight. I am pleased to welcome everybody who have joined with us in our presentation, especially in this particular topic of spine health seminar. Tonight, I am so grateful to have this privilege to welcome you all and at the same time to introduce our guest speaker. Our speaker was born in Leyte, Philippines. Of course, she's a Filipino. She was graduated Bachelor's of Science in Physical Therapy in 2011. She has numerous and rich experiences working in the field of physical therapy. She worked as neurophysical therapists, orthopedic physical therapists, outpatient, and pediatric physical therapists from 2011 to 2017. In 2017, she started working in skilled nursing facility as physical therapists for short-term and long-term care program. Our speaker tonight is a graduate of Doctors of Physical Therapy in 2020. Recently, she is working in the Palatine Nursing and Rehabilitation in Palatine Bridge, New York. Our speaker is Dr. Mary Ann Albay. But before she speaks, let us watch this short video clip.
The lumbar region of the spine, more commonly known as the lower back, consists of 5 vertebrae labeled L1 through L5. The lumbar region is situated between the thoracic or chest region of the spine and the sacrum. The lumbar spine typically has a slight inward curve known as lordosis. The lower back region contains large muscles that support the back and allow for movement in the trunk of the body. These muscles can spasm or become strained, which is a common cause of lower back pain. The 5 vertebrae of the lumbar spine are connected in the back by facet joints, which allow for forward and backward extension, as well as twisting movements. The 2 lowest segments in the lumbar spine, L4, L5, and L5S1, carry the most weight and have the most movement, making the area prone to injury. In between vertebrae are spinal discs, which cushion the joints of the spine and provide support. Discs in the lumbar region of the spine are most likely to herniate or degenerate, which can cause pain in the lower back or radiating pain to the legs and feet. The spinal cord travels from the base of the skull to the joint at T12L1, where the thoracic spine meets the lumbar spine. At this segment, nerve roots branch out from the spinal cord, running from the lower back through the back of the leg and down to the toes. Some lower back conditions may compress these nerve roots, resulting in pain that radiates to the lower extremities, known as radiculopathy.
Hi, good afternoon, everyone. Can you hear me?
Yes.
Okay. I'm May. I'm a physical therapist and a graduate of Doctor of Physical Therapy. You just watched a short video about the spine and its structures, as well as structural and mechanical causes of low back pain. Because today, we're going to be talking about the spine health. First of all, just a disclaimer, I'm not a medical doctor. I do not diagnose medical condition, but I am here to give a background about our spine, give recommendations on treatment about low back pain and how to prevent it. So, what is the number one reason why people visit the family doctor? It's the common cold. And the second reason, it's the low back pain. Especially in today's digital world, people spend more than 10 hours a day in front of the screen, switching between TV to computers to smartphones to tablets and others at home, even at work. So, according to research, 80% of adults experience low back pain at some point in their lives. And it is the most common cause of limitation of activity in those people under age 45, resulting to 40% of the missed work days. That is why it's very important for us to understand what is the spine, what it does, and how we can keep it healthy. Going forward, let me begin by telling you a message. For most of us, low back pain is not a disease. It is just part of our daily lives as we perform our daily activities, as we walk, as we go to work, and do the household chores. So basically, the bones, muscles, disc, and ligaments in our back supports us as we do million things in our back. But sometimes it backfires and gives us mechanical low back pain. The vast majority gets better by itself without any medical intervention. On the other hand, although it does get better, there is still a chance that it will occur again in 6 months or in a year. There are many types of back pain. So let's talk about the types of low back pain. The first one, it's called back dominant pain. This is the most common one. This is the pain in the back that sometimes go down to the leg, comes in spasm if you move. The cause of this pain is muscle spasm or muscle strain caused by improper lifting or back twisting. This usually happens when you hurt your back when lifting heavy objects or doing repetitive bending or twisting movement, causing strain or causing injury in your back. Well, this is a good pain. Not because it's good, but it is a good type of low back pain because there is no damage in the nerve or spine, just the muscles or the muscle strain. Thus, it does not require any surgery. So, what are the treatment for this? We have back stretching, hot compress, appropriate back exercises, and adequate rest will help. But it is very important to seek medical advice if the low back pain persists even after the home remedies. Number two, what is the second type of low back pain? We call it leg dominant pain. This pain is from the disc problem in our back or nerve problem if you guys are familiar with the sciatica. This is when the nerve is compressed or irritated by repetitive movement or disc, then we get the pain that goes down to the leg, anywhere from the below the buttock down to the foot. And this kind of pain, it feels better when you lay down. And if you have sciatica and if you think you have sciatica, it's a good idea to talk to your care team about it. The third one, this is really uncommon. It is called the leg pain that comes only when you stand or walk or run. It is relieved when you bend forward or you sit. If you guys are familiar with the spinal stenosis, this is it. It can be a pain that is anywhere in the leg or heaviness in the leg, which causes you to stop from walking or running. The medical term for this is neurogenic claudication. This type of low back pain typically happens to people over the age of 60. And again, this is caused by stenosis. or significant narrowing in the spine containing the nerve. The nerve compression from stenosis causes pain, and it's very important to talk to your doctor if you have spinal stenosis. Okay, most pain in the back, almost most of it in general, is always benign, but it's always good to know what we call the red flags. When you see red flags, you need to see your doctor as soon as possible. So, what are the red flags? If there's sudden change in bowel or bladder control or numbness in the groin or rectal area, because it could be a cause of something serious, because something might be pressing the spinal nerves in there. The second is infection. Infection can cause low back pain too. For example, if you have sustained fever, you need to see a doctor. If you have weakened immune system or high risk in urinary or other infections and you feel back pain, so you need to see a doctor for that. The third red flag is if you have risk for fracture in your back. If your pain started with a big fall or from a car accident, or if your bones are brittle because of osteoporosis, it's also considered as a red flag. And the fourth one is wonder if cancer may be involved. History of cancer, particularly in prostate, breast, or lung, and the pain appears to be constant, especially at night, or other symptoms such as sudden weight loss. So those are the red flags, and if and you need to see the doctor as soon as possible when you see those red flags. So moving forward, let us know what works for back pain. Number 1, it's the movement, exercise. So in the past, let's say 1990s, rest is the common treatment for back pain, but not anymore. Until recently, research shows people who don't move at all do worse. Rest is fine, rest is okay, but too much rest is not okay. But staying in bed all day long is not okay. There is a saying, motion is lotion. Exercise keeps your joints healthy. Although, let's say, those over the counter medications can help with the pain temporarily, but just temporary. But the key to release the pain, to ease the pain, is the movement. Think of your body like a car. If you don't drive the car, it rusts and gets stuck. Movement is the trigger mechanism to release the grease to our joints and make our joints healthy. Second one, the other ways to decrease pain is the spinal manipulation, which is performed by chiropractors, and also massage and even acupuncture combined with exercises. And the last one, if the pain does not go away after 6 months of treatment, it is considered as chronic pain. So even though there's nothing wrong with your back, but your brain perceives that there's something wrong and you get this very awful pain, it's considered as chronic pain. Other approaches that are proven to work for chronic pain are cognitive behavioral therapy. It is changing the way you think, therefore, it's behavioral. So you're being taken care of multidisciplinary team of professionals, includes doctors and psychologists and others. Okay, let's move forward. Sitting at the desk all day can eventually lead to pain and discomfort in our back and our neck. So, here are some tips to help you prevent getting the pain. So, what are the things that we need to do to prevent getting low back pain? First, and the most important, get a regular exercise. Without exercise, your muscles can become weak and deconditioned, leading to back pain and injury. In order to stay healthy, your spine requires a regular regimen of stretching, strengthening, and aerobic conditioning. Moving is a key part in protecting your spine. Go for a walk during the day. Get up and move, even just for 30 minutes. Like a walk for 30 minutes, 3 to 5 times a day will help you protect your spine. Strength training is also important because the stronger your muscles are, the more they can support your back from the impact from your daily activities. What are the best exercises? Work with your trainer or spine specialist to find the right exercises to help you stay healthy, strong, and stress free in order to make sure that these exercises are the right exercises for you because every person is different. Make sure that these exercises relieve your pain and do not add to it. I know and we know these exercises shouldn't be easy, but these exercises shouldn't make you sore that you can't function safely in the next day. The next one, how to prevent back injury or back pain. Many spine experts agree that smokers are more prone to back pain than non smokers. Why? Because smoking restricts blood flow to the disc that cushion your vertebrae, and smoking prevents bone growth. It prevents healing from certain surgeries. So ask your healthcare provider to help you find this best smoking cessation solution that will work for you. What is the next tips to prevent back injury? Maintain a healthy body weight because the extra weight, particularly in the midsection or the abdominal section, gets your body's center of gravity forward, placing unnecessary stress in your back muscles and the surrounding tissues. It's also possible to be too thin, as extreme thinness can also lead to low bone mass and risk of osteoporosis. Next, keep your core strong. So, what are our core muscles? These are our abdominal muscles and back muscles. You don't need to have the six packs abs. No, that's not. You don't need to have that. You just need to do exercises that is right for you and stretching because weak and tight back and abdominal muscles cannot support your back properly, leading to pain and injury risk. You can talk to your fitness trainer or your therapist if you want to know more about core exercises that is best for you because it is different, it varies from person to person. Number 5, this is also important. Use proper body mechanics. If you must move something heavy, first think. Be certain that you can do it safely. In order to reduce stress and injuries, avoid bending over to lift objects. What you can do is squat close to the object with its weight close to your body. Keep your body straight and your head up, or instead of pulling or lifting, consider pushing instead. And if the object is really too heavy and too large, just don't risk it. Risk it. Find another person, find another partner to help you share the load. Number 6, have a good posture. Hunching over our various gadgets, the phone, computers all day long can lead to stress, leading to neck pain and back pain. So, when using your computer or smartphone, be sure to maintain neutral posture. Take a break every 30 minutes. And if your computer screen is too high or too low, this could also contribute to shoulder or back pain. So, make sure that the top screen of your computer is set at eye level. This way, you don't have to constantly look up and down to prevent neck pain. Or also consider modifying your workstation. Consider using a chair with backrest that supports the curve of your lower back. Sit back in the chair and position your thigh horizontal to your knees. It's like 90 degrees when you're sitting at hip level, and do not just slump because it will give you back pain. And last but not the least, reduce stress. Why? The response of body has to stress can cause back muscles to tighten and spasm. Stress management is critical in treating and preventing back pain. Seeing a therapist or learning relaxation techniques like yoga, exercising regularly, or even just turning off your smartphone, taking a break will reduce your stress and reduce the occurrence of back pain. Lastly, in conclusion, low back pain, the prognosis of low back pain is excellent because only 3 out of 10 individuals with back pain seek medical advice. Most of them improve on their own. And over time, 90% of patients that doctors see with low back pain, they recover. And some people are just acknowledging the pain and just move on with their life. And if you experience low back pain right now or in the future, try to make small changes, such as modify your workstation, take breaks from the gadgets, improve your posture, and maintain a healthy lifestyle. Like go for a walking regimen, even for 20 to 30 minutes a day, for 3 to 5 times a week. That would help. And most importantly, if the symptoms or if the pain persists, you need to see the doctor. Now, let's proceed to the question and answer portion.
All right, thank you very much for the relevant information tonight. So I think our audience are very much eager to ask questions related to your presentation. You can ask questions directly, or you can write at the chat section. All right, I think one. Let me see if there is a question here. First question: is surgery ever an option if you have back pain?
If you have back pain, first consider doing home remedies like hot packs or exercises, because in the medical setting, surgery is the last option. Usually, there is a conventional treatment, which is physical therapy and exercises, and the doctor will usually see the result of the conventional treatment. Because if after how many months or how many weeks, if the conventional treatment doesn't work, then the doctor might look for other options, and surgery could be another option.
You're talking about exercises, and it is true that sometimes not all of us have the same pace when it comes to doing exercise. We have different tastes of exercises. What is your best recommendation, best exercise recommendation to our elderly, considering the physical and the age factor?
Well, for elderly population, um, the most important is to move, to stand up, not just sit in one place for how many hours. So even just a walking for short distances or walking as tolerated, that will greatly help to prevent back pain.
All right. Next question. Will heat help with back pain?
Well, first of all, it depends on the cause of back pain. So earlier, if it's just the muscle spasm or muscle strain, heat will definitely help relax the muscle and ease the pain, yes. But if the cause of low back pain is something else, like disc or other reasons, then sometimes um, that pain or that condition needs other options and heat might not work.
Okay. Another question, what is your recommendation about acupuncture?
Acupuncture is out of my scope of study and field of career, but according to research, it will help ease the pain too.
Okay, question from the Facebook. So, from our audience in Facebook, questions coming in. Is nerves injections recommended for someone with spinal stenosis?
Again, I'm not a medical doctor. I don't diagnose, but that question, I would like to answer that question, but I think that question is something a medical doctor will answer.
All right. Next question, is a soft bed foam or hard bed foam good for back pain? That is a good question.
Thank you. That's a very nice question. I think I would say not too soft and not too hard, because if the bed is too soft, you will just like go in a circle and that would be not comfortable laying in bed like too soft. And too hard, it wouldn't be so comfortable, I think, if the bed is too hard. And we have this like just the right amount of softness and hardness or the firmness of the bed that will usually like support your back.
Mhm.
That kind of bed is the good one.
Okay, another question from the audience. Are elliptical machines a good alternative to walking?
For me, walking is the best, but if you don't have like the luxury of time or place for it, then elliptical machines would do. Yeah, it would be better. It's better than nothing.
Okay. And another question. If your job requires you to be sitting at a desk in front of a computer for 8 hours, is walking, where is it? Oh, all right, here. Again, if your job requires you to be sitting at a desk in front of a computer for 8 hours, is walking for a half hour or an hour a day after work enough to counter act the amount of hours of sitting?
Absolutely. Definitely that will help or counteract. But it would be good if you take breaks like every after 2 hours, just stand up for 30 seconds or like do a little stretching in between. And yeah, walking is really important even if you work in the desk for 8 hours all day long. But it would be best if you take breaks in between and do some stretching or walking a little bit in between.
All right. So uh, would you recommend a rowing machine for exercise for back pain? I think
Well, first of all, you need to know the reason of your back pain, because there are certain conditions that causes back pain which a rowing machine is not very effective. Because when a rowing machine, you go like your trunk is an extension. If if you have spinal stenosis, that could that could be a contraindication because it's gonna compress the nerve in your back. It would be best to consult your physical therapist or your spine expert about it.
All right. Another question. We have so many questions coming in. All right. Most people now work from home, and some people purchase a stand-up computer disk. Looks like this is a good alternative for a typical computer disk.
I'm not really familiar what a stand-up computer desk is, but as long as the top of the computer, the top of the screen is at eye level and your back is straight and you're not slouching or hunching over, that would help. It's better than a computer that's so low and you have to look up and look down, and that's gonna kill your neck and kill your back.
All right. Now, what about deep tissue massage for back pain? Do you have any idea about this?
That is one of the interventions too. It is also effective, but again, if the cause of back pain is muscle spasm or muscle strain, is the massage, the tissue massage, it will relax and elongate the muscle. Thus, it decreases the muscle spasm and decreases the pain. But if the source of the pain is something else, then it wouldn't be effective.
Okay. Just to clarify, is standing for so long an issue too?
Yes, of course. Again, if you're staying in one position for too long, that is not good. You gotta sit, you gotta walk around, stretch, and bend, and that way your joints will lubricate and the circulation will keep going.
Okay. Another question. Is there a good position to sleep in I repeat, is there a good position to sleep in to prevent or help with back pain?
It varies from a person to person, so only a person will know what's the best position for him or for her. Because actually, it depends on the person what is the comfortable position.
All right. I think we don't have additional questions thus far.
How
Is there
about
any
you,
additional
Jed?
question?
Do you have a question for me?
Okay. But there is another one just coming in. Will massage help?
Definitely, massage will help. Is if the cause of the low back pain is muscle tightness or muscle spasm or muscle injury, then a massage will help. But if the cause of low back pain is like something deeper, like nerves, stenosis, or disc, massage, I think, will less likely help.
All right. One more? Or one more? No other questions?
One more.
All right. All right. Here. Let me. Right. If someone has lower back disc or sciatica pain, will walking help?
Yes, walking will still help. Again, it doesn't only help for back pain, but it also helps for your cardiopulmonary and overall wellness. So If you have lower back disc pain, you can do walking as tolerated. So if the walking at some point or some distance causes pain in your back, then you may stop. But yes, it will definitely help.
All right. There is a follow-up question from one of the audience in Facebook. Yeah, you answered this a bit, but FB is asking what type of mattress recommended for people with back pain? Any favorite brands? We're not actually making some promotions here.
Yeah. But I will suggest mattress that is not so soft and not so hard. Just firm enough to support your back.
All right. So at least it is firm enough to support. That's the point. Okay. Another question: how is leg numbness treated?
Leg numbness. Leg numbness um, could be caused by many reasons. So it would be best to consult your doctor or to talk to your doctor about it, because it could be a nerve issues or it could be a circulation issues. I'm not a medical doctor, so I don't diagnose, but I would recommend to see and consult your doctor, talk to your doctor about it.
Okay. Another question. I don't know if this was already discussed, but just wanted to get your idea on the proper position to use while working from home or computer use type of work from home.
So make sure that the top of the screen is at your eye level, so you don't have to look up and down and up and down. And also I would recommend using a chair with a backrest like the swivel chairs, and sit in that chair with your thighs horizontal to your knees. So you're like sitting with your knees in 90 degrees position, and make sure that your elbows are level with the desk. So you don't hunch or you don't slouch, not too high and not too low, just at eye level.
Okay. Another question. Can spinal stenosis cause numbness or tingling in the leg?
Definitely, because spinal stenosis is narrowing of the spinal canal or foramen in the spine, and this narrowing could irritate or could chop the nerve that goes into your legs, and it will cause numbness and pain. And you will experience it when you're walking or you're running and you're standing for a long time. If you have spinal stenosis, you can feel the pain down to your legs, and the pain will go away if you sit down.
All right. So here's another question. Is nerve damage curable?
I'm not a doctor, I don't diagnose, but based on my understanding as a physical therapist, nerve damage has different stages. There are stage 1 to stage 3. So it depends. For the early stages, it can be curable, but if in late stages where the damage is really extensive, it needs like extensive treatment, medical intervention.
Okay.
But there are
So,
just some nerve damage. For example, you slept wrong, and when you woke up, you have wrist drop, then sometimes that will just go away.
all right. There is another question here. So, let me see. Um, what do you think about an inversion table for back pain?
I'm not I don't have any, I haven't read any article about that yet, so I can't, sorry, I can't answer that question.
All right. So another question. Uh, One question here. Uh, chirop, chiropractic therapy. Is there a chiro in Albany? Are you recommend?
Chiropractic
Yeah.
therapy, um, I, I don't know, but you can use Google search for that. I can't recommend any chiropractic um professionals here.
Mm, all right. Gonna wait for more questions. There is one here. Right here. Well, we're just talking about, but is chiropractic useful or helpful? That's the question
Yes,
related to the first
definitely.
question. Yeah.
Yes, definitely. According to research, chiropractic practice will help for the low back pain too, because they do spinal manipulations that will help align the spine and help relieve the pain.
All right. This is about chiropractic. Okay.
That chiropractic.
All right. Another question. How do you treat foot drop when you are walking?
As a physical therapist, what we do usually for foot drop, we use what we call ankle foot orthosis. If you're familiar with it, the AFO, it's an orthosis that you can put in your shoes to
Mm,
prevent foot drop. We do exercises for the foot, like you bring your toes up like that. For example, this is your foot and you do this, that would help too.
okay. For the sake of curiosity, because there are audience we are not familiar what is this foot drop. So one of the questions, what is foot drop for those who do not know?
For those who do not know, what is foot drop? It is when you're walking, you when a person drags the toes, is not able to lift the foot up because of some foot muscle weakness
Mm,
that causes foot drop.
mm,
And it's also a sim or for example, a person has a stroke and the muscles of the foot are affected, the individual will present foot drop.
mm.
Yep.
All right. So it's about a muscle issue, right?
It could be a muscle, it could be a nerve, but most of the time it's a nerve issues
Yeah, okay. It's a nerve issue. Right.
or something in the brain that controls the muscles.
Mm. All right. So we're waiting for more questions, but is there anybody wants to ask questions? Just write in the chat section. You're working in the um, nursing and rehabilitation facility, right?
Yes.
And w- what are the common issues for the residents working with these people daily? You just give us information. What are the common issues, and how you as a professional, how do you help and treat these issues?
Our facility caters short term rehabilitation and long term rehabilitation. So short-term rehabilitation, these are for individuals that went to the hospital for surgeries, for example, hip fracture or stroke, and wouldn't be able to go home just yet. They need to get stronger before they can go home independently. So they go to nursing home for rehab. And the long-term individuals, when these people, these are the usually geriatric population that the family cannot be able to take care of them at home, so they send this population to the nursing home. And our
Mm-hmm.
common issues with them is they needed help for their daily activities. As a physical therapist, we also provide interventions for them so they can have a good quality of life, so they don't just sit there and lay there. As a physical therapist, we also train them to walk again, to be able to go to the toilet with less assistance. So we also do exercises for this old population, and based on my experience, exercises really help, and walking them really help,
Yeah,
not
that's
just
true.
physically, but like as a whole being.
Mm-hmm. Mm-hmm. And there's another question here. Does spinal stenosis contribute to foot drop?
It could, yes, of course. It depends on what level the spinal level was affected.
Okay. Now, another question. Are there different types of chiropractic treatments? And if so, do you recommend one over the other?
Um, I I can't answer that question right now because, as far as my experience as a physical therapist here, I haven't been coordinating with chiropractic chiropractic professionals. So it's hard to answer the question.
All right. There's a question about proper arm position while working with mouse or computer.
Yeah, make sure that your elbow is resting on the desk.
Okay.
And also it's very important to take a break and stretch your arms like this.
Mm,
This is how you stretch your arms. Because
stretching exercise.
yeah, this is also to prevent the carpal tunnel syndrome, because you're always working with the mouse and the computer all day long.
Mm-hmm.
The muscles here get tightened and
Mm-hmm.
inflamed. It could cause carpal tunnel syndrome. So take a break once in a while. Do
Yeah,
stretching.
that is true. So again, if we don't have more questions coming in, there's another one. One question. Oh, it's not actually a question, but just to express her thank and gratitude for the very informative session and for sharing your knowledge to all our audience tonight. And it's very much appreciated. Uh, Thank you everyone for joining our program. Of course, Dr. Albay, thank you for your time and thank you for sharing your expertise that is actually measured when it comes to question and answer portion of our program. You have rich knowledge when it comes to, helping people, especially on issues of spine and other issues related to it. So we hope that this program was helpful and you learned something special tonight. Please come to our next event, Real Talk about Allergies and Asthma with Dr. Jocelyn Celestine. Dr. Jocelyn Celestine is the director, is a program director and a professor of medicine, pediatric immunology and microbial disease. Please join with this program on April 27, Tuesday, this coming Tuesday, April 27 at 6:30 in the evening. Thank you very much once again. Thank you, Dr. Albay, and have a wonderful evening.